Good morning, students. I am Stella Sherry, and today I want to talk to you all about the benefits of breastfeeding. So, you've already studied in detail in the nutrition class as to what are the components or the nutrients which are there in breast milk. But this we are going to see a little bit more about what are the benefits both for the baby and for the mother. So, these are very simple points, easy for you to remember. Okay, the first thing is we will look at what is the definition of exclusive breastfeeding. Exclusive breastfeeding, as you all know, given by WHO and UNICEF, is that the mother should be able to feed the baby exclusively for 6 months and also up to 2 years of age, as according to the needs of the baby, and if the mother is also able to feed the baby. But exclusively 6 months is a must. Not even water should be given to the baby. So you may ask, what about mothers who are working or who are not having an option to breastfeed their babies? They can always express the breast milk and store it and can instruct someone at home, the caregiver, to feed it to the baby. Or if there is no breast milk option available for the mother at all, she can approach any of the human milk banks that are available in almost every city nowadays. So what are the benefits? Why do we stress that, infants or babies have to be fed breast milk? We all know about the nutrient composition of breast milk. So it is not only that it contains protein, it also contains the adequate enzymes and the immune bodies which are essential for a baby to thrive, because thriving is something very, very important for a human infant. So, what does it protect? What are the kinds of infections? What are the kinds of conditions that feeding a baby exclusively 6 months and even beyond? Of course, with the addition of complementary feeds beyond 6 months. What are they? Okay, number one is acute otitis media. What is acute otitis media? It's nothing but a commonly found ear infection. So, children, many studies have found that the immune bodies which are there in milk, especially immunoglobulins, provide passive immunity and they protect the babies against common childhood ear infections. The next thing that you see is that they do have protection against any kind of childhood asthma. So it has been, studies have proven that babies who are bottle fed or formula fed often have a higher instance of getting asthma. So here, when you're breastfeeding a baby, you will find that such reactions or such immediate reactions are something which is not present in babies who are commonly breastfed. The next thing what you see protection for babies is against common gastrointestinal infections. Here you will find diarrhea as a common infection which children often always have, especially if you're bottle fed, because we all know that the bottle has to be sterilized well and the formula has to be prepared well. So if the bottle is not being sterilized well and if the mother is ill-equipped or uneducated or is not aware of it, then definitely there can be contamination of the bottle, the feed as well as the nipple. So what happens is that it is always best to breastfeed the baby. So breastfeeding provides for the right kind of bacterial development in an infant's gut, along with the right kind of immune bodies, which are going to prevent any diarrhea conditions. In fact, even if an infant gets diarrhea, it is always recommended that the mother continues to breastfeed the child. So we dealt with the stomach, we dealt with the lungs, okay? We saw about asthma. Children can also be prevented from getting pneumonia if you are properly breastfeeding the baby. Now let's go on to some of the lifestyle conditions which can be prevented due to breastfeeding. What are they? Number one is, of course, obesity. See, when you formula feed a baby, you will see that because of the extra nutrients and the nutrient rich environment that is given to the baby at particularly set schedules, you will find the baby's weight, height, everything will be more, the growth will be more rapid. But you will not see the same for a breastfed baby, but you will see at a rate which is suitable for the baby. The baby will assimilate nutrients better, whereas in formula feeding, you're overloading the baby with nutrients, which are not really needed at that juncture. So how do you prevent obesity? See, obesity, we all know that the fat cells, the number of fat cells are determined, okay, at very young age. So definitely if you're feeding an over nutritious or a nutrient dense food, okay, much early, you're going to increase the number of fat cells and you can also increase the size of the fat cells. So such children automatically will have a different kind of food pattern, a feeding pattern which is different. Okay. Now, what is the difference between children who are breastfed and those who are formula fed? In breastfeeding, you're feeding the baby on demand. And the baby also will have a set feeding pattern where the baby has to use some energy to suckle. So that particular energy use is lost when the baby is formula fed, because through a bottle the feed is available very easily. So the effort from the baby side is less. And the demand feeding ensures that the baby feels or listens to the cues of hunger, and that at that time when the baby is fed, that the baby is also able to regulate its own appetite. Another thing which is seen is that there are many metabolic markers which are there in our body, especially like leptin, ghrelin, insulin like growth hormone. All these function very well when a baby is breastfed and fed on demand. Whereas when a baby is formula fed, you will find that there can be a disruption of all these different metabolic markers. And later on, a disruption of these metabolic markers can later on lead to an increase in accumulation of fat and insulin resistance, which is what causes type 2 diabetes mellitus. So later on in life, when there is a disruption in the metabolic markers, we can say babies who are not breastfed exclusively can develop type 2 diabetes mellitus. So of course it is a lifestyle factor, but we all know that nutrition is something which is decided in the womb. So we call it as nutrition from womb to tomb. So what is happening in the mother's womb is what determines a child's health until it's an adult and until the child reaches its tomb. So the first 1,000 days is something very, very important, the nutritional status of the mother. And also after the baby is born, exclusive breastfeeding is extremely important. So obesity can be prevented if a baby is exclusively breastfed. That is the take home message here. You can prevent diabetes mellitus, both type 2 and type 1. Now, what is it about type 1 diabetes mellitus? Usually it is an autoimmune disorder, or you can say that it is an idiopathic cause where we do not know. They have found out, there are many research reports which have shown that feeding children cow's milk can cause type 1 diabetes simply because of the casein. Okay. So here again we have to be careful as to what kind of milk is being fed to the baby. And there are many cancers, especially childhood leukemia, can be prevented because of feeding the baby's breast milk. Apart from this, there are umpteen researches and it has been proven that infant mortality can be reduced when we breastfeed a baby. Okay, how do we reduce infant mortality? Primarily because we can prevent deaths due to diarrhea and deaths due to pneumonia, because these are the two leading causes of deaths of children who are under 5. And also studies have shown that sudden infant death syndrome, SIDS, can be prevented because of breastfeeding, because breast milk contains factors which allow the lungs to develop, which aid in the lungs to develop for a very, very young infant. So these are some of the numerous benefits for the baby. Now let's see what are the benefits for the mother. So the first benefit is of course bonding. So as a mother is going to breastfeed the baby, of course, she is going to hold the baby. There is a close touch between the mother and the baby. And there is a very important thing called touch which brings on emotional bonding and connectivity. And this helps in the growth of the baby. It's a vital factor in the growth of a baby. And also it releases more oxytocin for the mother, so she can produce more milk. And there is release of milk. So it is a feel-good factor there. Okay. So apart from this, studies have shown that feeding a baby, breastfeeding, is a very good for preventing, breast cancer, ovarian cancer, endometrial cancer in the long term for a woman. Okay. And it's also good in weight loss because you're going to spend more energy and you're going to convert that energy into milk to feed the baby. So it is automatically a woman who gains weight during pregnancy is going to reduce that weight gain, okay, just by exclusively breastfeeding the baby. Okay. Not only this, it aids, in the postpartum hemorrhage stage and, release of the placenta because of the, the oxytocin release. and a lot of things. So it will help the uterus to shrink in size also. So apart from an emotional connect with the baby and an emotional feel good factor, breastfeeding is very helpful for the mother to prevent herself from any future lifestyle disorders. So it is both the physical aspect and the mental aspect that we see here that the mother is benefited from. So, in a nutshell, if you look at it, breast milk is the best milk for the baby, and breastfeeding is a best practice for a mother. So, any other complementary feeds or anything which comes after 6 months is beyond breastfeed. Many mothers have this doubt that, after 6 months I should stop. And many mothers have gone ahead and done it because they were ignorant of the fact that they could continue to breastfeed a baby. Okay, many societies encourage. So, social support is very, very essential for a mother to continue to breastfeed her infant. So, social support in the sense if she's a working mother, obviously she will need support to keep the express breast milk for the baby and somebody who can feed it to the baby at the right time when it is on demand. But beyond this, the support of the husband and support of the other members of the family, the extended family, is very, very important. So it is not a stigma. Breastfeeding should never be considered as a stigma. It is not a social stigma. It is something which every mother should be proud of, that she is able to feed the baby. So it is society whose eyes have to change in the view they view how they look upon a mother who breastfeeds in public. So for this also our government has done a lot of beneficial things. One thing is setting up places for breastfeeding a baby, whether you go to a mall or even if you go to a bus stop or a bus depot, you have exclusive places now where you can breastfeed a baby. Even otherwise, it is not shameful to breastfeed your own baby. So, the message here is that exclusive breastfeeding should be done and it is a right of every infant. Not only that, it is a mother's right to exclusively breastfeed her baby. So, an awareness regarding this has to be created. So, as young students, as undergraduate students, I am sure all of you will promote breast milk feeding in and around your family members and you yourself will take positive steps towards this. So, thank you all for listening patiently to my lecture on this. Thank you.